Hello, good morning to one and all. Myself Dr. Atul, Chief Physician Aradhana Ayur Clinic Mannarkkad. So in this video, we will be continuing the anatomical topics only as we had started the anatomy classes. So in today's video, we will be seeing regarding the bone, that is osteology. What is osteology? And also we will be seeing the classification of the bone according to its shape and size, according to the location and microscopic view. We will be seeing what are the classification of that bones. So please stay tuned with us, watch the video till the end, and if anyone is new to this channel, please don't forget to subscribe our YouTube channel and also press on the bell button, click on the enable all notification so that you will receive every notification when we upload the new videos. And also support us as you are doing in the past. So let's don't waste our time and let's go to the session. So today's topic is osteology, the classification of the bones. So today's topic is the osteology and classification of bones. So let's deal one by one. Let's see what is osteology. So osteology is also a study. It's a study of the skeleton, the structural and functional aspect of the skeleton and the bony part, which is called as the osteology. So it is also a study of the structural aspect, functional aspect of the skeleton along with and the bony parts, so both this aspect which together we will call as the osteology. So osteology. Next is the classification of the bones. So before going to the classification of the bone, let's see what is this bone. So bone are hard connective tissues. It gives the proper shape to the body. So it is a hard connective tissue. It is a hard connective tissue. It is a hard connective tissue. Bones are the hard connective tissue. It gives the proper shape. So many are there, like composed of osteocytes, osteoblast, like that many things are there. We will be discussing one by one only. So when we break this word osteology, osteo plus logy. So osteo means bones and logy comes to plus cartilages plus cartilages. Okay. And also we can define the osteology as the branch of anatomy. It is also a branch of the anatomy which deals with the study of the bones and the cartilages of body. As I had told, the study and functional and structural as well as skeleton of the body, and also can be defined as a study of bones, as I told, osteo, bones, and logy is the cartilages of human body. When we study that part, that is known as the osteology. It is derived from two words, that is osteo plus logy. Osteo is a part of the bone, logy is cartilage. So study of both the bones and the cartilages of the body is known as the osteology. Next, let's discuss the classification part. What are the classification of the bones? What are the classification of the bones? Classification of bones. So while talking the classification, first we will see based on the shape and size. Small bones will be there, right? Small bones will be there in size and long bones will be there Some bones will be flat, some will be sesamoid type, irregular type. So it is depending upon the shape. Small size, large size, it depends on the size. So based on the shape and the size, the bones are classified. So first one comes is that is long bones. As the name only indicate, long bones. So these bones are cylindrical in shape. It is cylindrical in shape. These long bones will be cylindrical in shape and will be elongated, as the name only suggests, long bones. So it will be elongated type and its shape will be cylindrical. Medullary cavity will be there. And also these long bones consist of, if you are considering this as a bone, it is a cylindrical, like considering this bone, these long bones will be having three parts. Mainly it will be having three parts, that is this. So this is called as we had discussed in some of the bones, we are discussing, I guess, radius, we had discussed the upper end, shaft and the lower end. And in this long bone also, it is having three ends or three parts, that is the upper end, this is the middle part is a shaft, and the lower part will be the lower end. So long bones will be having three parts. So again the long bones are classified. These long bones are classified again to the long bones. So it is classified into two types, long bones and coming to the long short bones. Long bones and the long short bones. Long bones, while dealing with the long bones, it is having the same feature as that of the long bones. Long bones. So length will be the same, length will be elongated one with cylindrical type only, but its length will be somewhat more long compared to that. Length will be somewhat more. Long bones. Like humerus is a long bone, you can see cylindrical only. Radius also same. Ulna also same, long bone. As we had discussed this one, radius as a long bone. So next is a long short bones. Long short bones, again they are having the same feature as the long bones, that is they are having elongated type, they are cylindrical type, but its length will be only, it will be small. Length will be small compared to that of the long bones or long bones. Length will be comparatively less. That much difference is there. Like metacarpals, we had discussed what is metacarpal, metatarsal, etc. So these are some of the example of the long short bones. Next, let's discuss according to the shape and size. Long bones is being classified again two, that is long bones and long short bones. The second type is the short bones. So as the name only suggests, short bones, that is small in size. The size will be small compared to long bones, and shape, they are cuboid shape. Example, when we say, you can say of the carpal bones which are present in the wrist area, carpal bones you can see. So this cuboid in shape, the short bones will be cuboid in the shape. That is very important. One example every time you have to remember, so that you can quote that example along with the explanation. So example is carpal bones. Next, let's discuss according to the shape, that is flat bones. Next is a flat bones. They will be flat. Name only suggests what type of the bone is. So it will be a plate like bone. like bones are called as flat bones. Example, scapula. Very good example it is. You can, if you have watched the scapula, it is like a plate. It's a flat bone. Okay. Again, our example is parietal bones are there. Better you can remember the scapula coming in the upper part of the body. Next, let's discuss what is pneumatic bones. That is very familiarly this been asked in the exam papers. Pneumatic bones. As a 2-mark question they can ask. So inside cavity should be there, that is filled with the air. So cavity will be there in the bones. So in bone, cavity will be present. Inside cavity will be there, which is filled with the air. Filled with air. Air filled. Okay. And that air cavity is known as air sinus. Air sinus. And it has been lined by mucous membrane. These bones are lined by the mucous membrane. So these bones are having some of the cavities inside which are filled with the air, and that cavity, that air cavity is known as the air sinus, and these bones are being covered or lined by the mucous membrane. So while we see some of the example, I had told everything you have to quote one example. So like frontal bone. Frontal bone is one of the example, and ethmoid bone. Ethmoid bone. Frontal bone and ethmoid bone. Air cavity is present to reduce the weight of the bone. So if air cavity is there inside the bone, it reduces the weight of the bone. Okay. Next, let's discuss what is a sigmoid bone. So until now we have discussed the 4 types, that is the long bone. Second one we had discussed short bone. Before that, the long bones which has been categorized into 2, that is long bones like humerus, radius, ulna, and long short bones like metatarsal, metacarpal, etc. Secondly, we had discussed the short bones which are length is small, carpal bones. Next we had discussed the flat bones which are like plate like, that is scapula. Pneumatic bones, very important, which is having inside cavity which is filled with the air, that is known as air sinus, and lined by the mucous membrane. So its example coming as ethmoid or frontal bone, and it is present to reduce the weight of the body. So let's discuss the 5th one, that is the sesamoid bone. Sesamoid bone. So it is a seed like structure. Seed like structure. Seed like structure. So these bones are originated from tendons. These bones are originated from tendons. So one of the example you can say is patella, knee bone, patella. So largest sesamoid bone which is present is patella. So you can expect this question also, which is the largest sesamoid bone in the body? That is a patella bone that is present in the knee joint. So it is originated from tendons, that is a sesamoid bones. Sixth type which we will be discussing is the irregular bone, that you can get from the name only, irregular bone, which is not regular, doesn't have any of the characteristic features, having an irregular structure. So this irregular bones name only suggests that it is a irregular structure. It is having a irregular structure, doesn't have any characteristic, doesn't have any characteristics feature. So doesn't have any of the characteristic features, and it is a irregular structure. It is a structure wise it is irregular and don't have any other features also. So like vertebrae, a very good example, vertebrae. So for your kind information, I will let you know that whatever class we are dealing out here is based on my knowledge, and as a human we all make mistakes. Somewhere unknowingly we come to some of the mistakes. Okay, so better that you listen to these classes, and also from your point of view, from your part, you just go and check with your textbooks and the notes which you are preparing, which your gurus are giving. Just cross check with that, is that correct or any of the mistake is there. You can let me know. It's okay, we all commit mistakes, it's not a big matter. So you have to go and check from your part also. Okay, it is only for the information purpose. So coming to the video, the fifth type is sesamoid bones, sixth is the irregular bones. Fifth is sesamoid bones, that is a seed like structures originating from the tendon. Largest sesamoid bone is the patellar bone. Patellar bone is the knee bone, that is the largest one. This you can expect in some of the entrance point or anything. And largest the irregular bones, that is irregular in shape. Its shape is only irregular, doesn't have any of the characteristic features as vertebra. So this was some of the types of bone or classification of bone based on the shape and the size. Size, that is long bone, short bone, long short bone, irregular bones. Coming to pneumatics, sesamoid bones we discussed, flat bones we discussed. So these were some of the classification based on the shape and the size. Let's discuss next is the classification based on location. Based on location. So first is the axial bone. It is been divided into two parts, that is axial bone and appendicular bone, and the appendicular bone. So axial bone, bones present other than the limbs, bone present other than upper limb and lower limb. So other than upper limb and lower limb, any bone is, that is known as axial bone. Bone present other than in the upper and lower limb, like sternum, it may be example you can see, ribs, sternum, vertebra. These are the axial bones. Next is the appendicular bone. Appendicular bone present in the lower limb and upper limb. The bones which are present in the upper limb, lower limb, it may be the radius, scapula, tibia, fibula, etc., which are present in the upper limb and lower limb, that is appendicular bones. Based on location, appendicular bone, axial bone, the bones which are present other than the lower limb and the upper limb, appendicular bones which are present in the upper limb and lower limb. That's all. What is the classification based on the location. So we have discussed the classification based on the shape and the size, and discussed based on the location. So this was for the today's class. We will be coming with a new topic in the next video. Until then, thank you. Keep supporting us as you are doing in the past. Thank you for watching the video.